for your guidance, provision, and healing. Keep this country united and far from any danger or calamity as the country is nearing the holiday season. Lord Jesus, your name is greater than any disaster or any virus. We beseech you, forgive us, Lord, and free us from fear and worry. Enlighten us and guide us towards the right decision to overcome this problem as a nation who worships you, dear Lord. In Jesus' name, amen.
Amen. Thank you, Tita Lorna. This
Yes.
meeting is now called to order.
Okay.
Madam Chair.
Yes, Congging.
I move that we dispense the calling of the roll. So
there's a motion to dispense the calling of the roll, duly seconded. Is there any objection? Hearing none, the motion is approved. We'll now proceed to the approval of the minutes of the previous meeting.
Madam Chair.
Kong Jun.
I move to defer the reading of the minutes of the previous meeting and the approval of the same. I so move, Madam Chair.
Second, Madam Chair.
Motion to defer the reading of the minutes of previous meeting and its approval, duly seconded. Is there any objection? Hearing none, the motion is approved. Thank you and good morning again. I would like to recognize first the presence of the following members. Representative Lorna Bautista Bandigan, Representative Sharian Tan, Representative our Vice Chair Ruth Mariano Hernandez, our Vice Chair also Representative Dalia Loyola, Representative June Gato, Representative Cheryl De Loso Montalia, Representative Manuel Cabuchan III, Representative Victor Yap, our Deputy Speaker Rosemary Arenas, Representative Alexi Tutor, our Vice Chair also, Representative Ging Swansing, Representative Alberto Bobby Pacquiao, Representative Presley De Jesus, Representative Antonio Albano, Representative Cheryl De Loso Montalia. Okay. Check on other members. That's all for now. We'll recognize later as we go on. We have Representative Onyx Crisologo. For our resource persons, we have Yusek Mirna Cabotaje, Director Rodolfo Albornoz, Dr. Vito Roque Jr., Dr. Amado Tandok, Mr. Roderick Napulan, Mr. Brian De Guzman, Ms. Agnes Segara, all from the Department of Health. From the PhilHealth, we have Ms. Hilda Diaz and Attorney Ellie Santos. From the DND, we have Attorney RJ Lim. From the National Security Council, we have Mr. Levi Fabelliar. From the Department of Budget and Management, we have Ms. Rowena Marte. From DFA, we have Ms. Ana Iglesias, Attorney Hamil San Jose, Mr. Kevin Gomez. And Scholastica Camba. From the Department of Justice, we have Mr. Melvin Suarez. From DILG, we have Yusek Martin Dino. From the Department of Labor and Employment, we have Mr. Marco Valeros. From Philippine Red Cross, we have Dr. Jeremy Cordero, Dr. Arthur Catley. And from the Association of Health Maintenance Organizations of the Philippines, we have Mr. Carlos Da Silva. From Medical Action Group, we have Dr. Julia Raquel Remando Magalong and Ms. Edelisa Hernandez. From Philippine Association of Medical Technologists, Inc., Mr. Ronaldo Puno. From Governor Faustino N. Memorial Hospital, we have Dr. Nelson Pagurigan. Okay, thank you. Again, welcome to the committee hearing. For today, we're going to discuss 10 local bills and present and approve 2 national bills, the National Health Security Act and the bill on establishing the Medical Reserve Corps. To give way for the presentation of these 2 national substitute bills, may I request our member, Dr. Jun Gato, Kong Jun Gato, to preside.
Thank you, Madam Chair. Good morning, everyone. May we now proceed with the presentation of the bill on National Health Security Council Act, to be presented by the principal sponsor, Madam Chair Helen Tan.
Share na. Thank you, Mr. Chair. Again, magandang umaga po sa inyong lahat, Your Honors, ladies and gentlemen. Republic Act number 11223, otherwise known as the Universal Healthcare Act, was enacted into law more than a year ago. Its passage was hailed as a new dawn for healthcare in the country, and I am happy that through the humble work and untiring perseverance of this committee, this landmark health reform legislation was made possible. Today, this committee, as gatekeeper of all matters directly and principally relating to public health, is standing once again at the crossroads of change with the unveiling of the proposed Philippine Health Security Act that seeks to provide and institutionalize the needed synergy between these 2 important health concepts and bring into fruition the completion of the other side of the coin under the ambit of Health System Strengthening Policy Mechanism, UHC, and health security having been frequently considered as 2 sides of the same coin. As principal author of this measure and the chairperson of this committee, allow me to present to you the highlights of the substitute bill, which the technical working group has painstakingly crafted by consolidating the various measures and incorporating the views, position, and recommendation of different agencies, experts, and resource persons on the subject. To give context to this discussion, let me briefly delve into the rationale of the substitute bill alongside certain fundamental concepts and principles of health security. The WHO believes that the pandemics, health emergencies, and weak health systems not only cost lives but pose some of the greatest risks to the global economy and security faced today. Further, universal health coverage and health security are 2 sides of the same coin. Improved access to healthcare and strengthened health systems provide a strong defense against emerging threats, whether natural or man-made. This statement has increasingly become relevant with the recent findings of the Global Preparedness Monitoring Board, an independent monitoring and advocacy body that aims to assess the world's ability to protect itself from health emergencies and identify critical gaps to preparedness across multiple perspectives that humankind is stumbling toward the 21st century, equivalent of the 1918 influenza pandemic, which affected 1/3 of the world's population and killed approximately 50 million people. Based on the report, only 1/3 of the countries as of 2018 have the capacities required under the international health regulations, and that the great majority of the national health systems would be unable to handle a large influx of patients infected with respiratory pathogen capable of easy transmissibility and high mortality. The Global Health Security Index by Johns Hopkins Center for Health Security and Nuclear Threat Initiative reveals that no country in the world is fully prepared for epidemics or pandemics, with each one having gaps to address. Although the Philippines placed an above average 53rd out of total of 195 countries included in the study, the country also scored 0 in the total of 5 health security indicators, namely biosafety, dual-use research and culture of responsible science, linking public health and security authorities, communications with healthcare workers during public health emergency, and the joint external evaluation and performance of veterinary service or PVS. Under the last category, where the Philippines got the grade of 0, one question which was particularly asked was, has the country completed and published within the last 5 years either a national action plan for health security to address gaps identified through the joint external evaluation assessment, or a national GHSA or Global Health Security Agenda roadmap that sets milestones for achieving each of the GHSA targets? Obviously, the resounding answer to this important query is no. Incidentally, the joint external evaluation of the IHR core capacities of the Republic of the Philippines reveals that while the Philippines has developed capabilities in various program areas for public health emergency preparedness and response, there are still challenges in achieving a harmonized approach for implementation of the IHR. Several identified challenges are not only relevant to IHR implementation, but are common across the health sector and include the implementation of policies and regulations, effective coordination between national and local levels among sectors, and investments in institutional capacities. Accordingly, to capitalize on the momentum generated by the JEE in the Philippines, an overarching priority recommendations of the JEE team are for the government to enhance high-level political commitment and accountability at all levels with adequate resourcing and engagement of all relevant sectors, develop an overarching national action plan for health security, which is costed, map risk-based priorities to optimize resources within and across sectors, and guide investment and the harmonized implementation of the IHR. Strengthen monitoring and evaluation practices and foster a culture of continuous improvement by feeding the lessons from the after-action reviews into ongoing refinement of the system. Designate an overall high-level multi-sectoral body with leadership from the health sector to oversee and set direction for the continued implementation of the National Action Plan, with the National IHR focal point playing a key role to improve coordination among all relevant stakeholders. Foster the institutional capacity of health sector to lead the prevention, detection, and response to public health events and emergencies. Further, optimize the public health emergency preparedness and response action at the regional and local levels through investing in advocacy, guidance, training, and exercising to improve collaboration between national and subnational levels. Against this backdrop, may I now present to you the output of the TWG on the Philippine Health Security Act. The bill seeks to introduce as well as institutionalize those essential activities that are required to minimize the danger and impact of acute public health events that endanger the collective health of the population. In order to do this, the bill aims to establish a health security national action plan, strengthen institutional capacity to implement disease prevention, surveillance, control, and response systems, and implement contingency plans to deal with the public health events and emergencies deliberate release of biological or chemical agents intended to harm civilian populations or attack the healthcare delivery system. Provide and strengthen a mechanism for health security interface. Optimize health security based on the country's unique risks, challenges, and resources. Develop an effective system of risk communication. Provide a high-level framework to guide the implementation of the Health Security National Action Plan. And at the center of this legislation is the crafting of the National Action Plan for Health Security, to be named as the Philippine Health Security National Action Plan, or PHS-NAP. What is this plan all about? It is actually a country-owned, multi-year planning process that can accelerate the implementation of the country's international health regulations, or IHR core capacities. It captures national priorities for health security, brings sectors together, identifies partners, and allocates resources for health security capacity development. It also serves as an overarching process to capture all ongoing preparedness initiatives along with the country's governance mechanisms for emergency and disaster risk management. The National Action Plan for Health Security usually follows a three-step strategic framework. Inception, where review of existing plans, capacity assessments, stakeholders analysis, SWOT analysis, and prioritization of technical areas such as prevention, detection, and response takes place. Number 2, development, where prioritization of activities are made, monitoring and evaluation, costing and mapping of resources, and approval of enforcement. And number 3, implementation, where the following activities: reprioritization of implementation, integrating into national development planning, monitoring, evaluation, and reporting, and periodic review and update take place. The National Action Plan is what the bill is all about. And this is what the late Senator Miriam Santiago had in mind when she filed her proposed Pandemic and All Hazards Preparedness Act in 2013. What she wants to do then is to create a national health strategy for health emergencies, which shall provide for integrated policy coordination and strategic direction with respect to all matters related to national public health and medical preparedness and execution and deployment of national response before, during, and following public health emergencies. During the early months of COVID-19 pandemic, this is what many in the social media, those who are in Facebook, Twitter, Instagram, and Viber, as well as media, are talking about. Many believe that had it been enacted into law, the country would have been in a better position to prepare for COVID-19. This substitute bill is what the bill of the good Senator Santiago is actually all about. But this proposed NHSA is a lot bigger in scope, more comprehensive, and closely runs along the language and parameters set forth by the World Health Organization. Again, let me underscore one of the JEE's recommendation: the development of an overarching national action plan for health security, which is what this proposal is. It will be the task of the Philippine Health Security Council to craft the PHS-NAP. This council will be created as an interagency body administratively attached to the Department of Health. PHSC is what the IATF, or the Interagency Task Force for the Management of Emerging Infectious Diseases is under Executive Number 168. However, the Philippine Health Security Council is reckoned to be more responsive to the JEE recommendation that calls for effective coordination between national and local levels and among sectors, high-level political commitment and accountability at all levels, and the designation of an overall high-level multi-sectoral body with leadership from the health sector. This explains why Section 8 of the substitute bill provides for at least 67 PHSC membership comprising of an all-cabinet membership as well as key sectoral agencies of government and the private sector, including the civil society organization. Health security, after all, just like its better half, the UHC, is supposedly a whole of government, whole of society, whole of system, in fact, a whole of nation approach. Given our COVID-19 experience that marshaled the entire government, both national and local, structure and resources, I believe that this kind of high-level political commitment and accountability, as well as high-level multi-sectoral body with leadership from the health sector, where each single agency will be tasked to craft their respective action plans for health security, is just what the doctor prescribes. The Philippine Health Security Council's other functions will include the strengthening of the partnership with foreign and international organizations, including but not limited to data collection, research, and other essential programs and services, formulation of guidelines and policies for the effective and efficient implementation of the PHS-NAP, strengthening of public health emergency preparedness to ensure efficient government response to assess, monitor, contain, control, and prevent the spread of any potential epidemic in the Philippines, and institutionalization of efficient mechanisms to ensure cybersecurity of medical devices and hospital networks, and prevent cybersecurity breaches that may affect the operation of medical devices. The bill also seeks to strengthen the Health Emergency Management Bureau of the Department of Health, especially in terms of personnel support, as it is set to serve as PHSC's secretariat. It has likewise provisions for the declaration of public health emergency, and very importantly, as suggested by my good friend, Representative Ging Swansing, it provides for the regional and local mechanisms for the implementation of health security, which is in consonance with the JEE recommendation for an effective coordination between national and local levels and even among sectors. Through this framework, the country is assured to have a top-down health security framework where the regional health security councils, provincial, city, municipal, and barangay health security councils will have to craft their respective regional and local health security action plans consistent with the PHS-NAP, alongside with the respective agency action plans by the member agencies under the PHSC. Lastly, Section 14 of the bill seeks to create a health security advisory group or an advisory body to the PHSC and the President of the Philippines on matters of health security. The Health Security Advisory Group shall consist of the former health secretaries, public health specialists, Filipino scientists and scholars, and other health professionals and experts that PHSC may deem necessary. All members who shall be appointed to the HSAG must be of good moral character and recognize probity and independence and have no pending case or criminal and administrative record. On a final note, I would like to underscore the proposed NHSA is deeply necessary if we are to bolster the country's core capacities to implement disease prevention, surveillance, control, and response systems, implement contingency plans to deal with a deliberate release of biological and chemical agents intended to harm civilian populations, and provide and strengthen the necessary mechanisms for health security interface. I am hoping that this equally important legislative measure, one which is considered as the other side of the UHC coin, will generate the same enthusiasm and passion and gather the same support and commitment as so many of us did for the UHC law. So I am counting on the support of everyone in this committee for the speedy and favorable support or consideration of this important piece of legislation. Maraming salamat po and good morning. Thank you, Mr. Chair.
Madam Chair, good morning.
Thank you very much, Madam Chair, for the very excellent presentation. May we now call on the next is
Mr. Chair, may I interject and be recognized? Congressman Tony Pet Albano from Isabela.
Yes, Kong Tony Pet, you're recognized.
Yes, with the indulgence of the committee, knowing that I am actually doing relief operations now, but I have a bill pending to increase my bed capacity. May I beg the indulgence of the committee for me to beg for me to sponsor my bill and say my piece before I leave, Mr. Chair, if it's okay with all the members, and of course our chairperson, Madam Tan.
Madam Chair, if it's okay with Chair Helen, I think we should allow Congressman Tony Pet to present his bill.
Tony Pet, ako na lang mag-sponsor ng bill mo.
Ma'am, if I can just given an indulgence of 5 minutes lang, ma'am. Nahiya lang kasi ako ngayon. Bilis ako dito sa relief operations ko. Gusto ko lang talagang i-amend pa itong bill kasi 300 lang ang inihingi. Mukhang gusto ko ng 500 with the indulgence, ma'am.
Go ahead, Congressman Tony Pet. You're recognized.
Thank you, Chairperson. Our Batanes good Chairperson, Jun Gato, and thank you, Chairperson Tan. Woman Tan. I'm actually forlorn and depressed actually on the onslaught of the typhoons that have been battering. And I'm sure you've seen in media, wala pa ho kami masyadong tulog dito at we're doing relief operations. But I thought that this is a very important bill for me to introduce, House Bill number 6539. We have here the Faustino D. Memorial Hospital in Ilagan City, and we only have a bed capacity of 100. And we are the largest province now, with Palawan being cut into 3. And may I introduce my explanatory note as the sponsorship for this bill, but more so with the indulgence of our committee. And I've already talked to our director, hospital director, Dr. Nelson Pagirigan, and our Region 2 DOH regional director, who is also endorsing that we amend now my bill from asking just to increase to 300 bed capacity now to 500 due to the fact that there is a COVID pandemic, and also yearly we do have these kinds of unprecedented flood that has hit my district in the whole of Cagayan and even a lot of parts of Isabela. As you know in the reports, I would like to report here that the first district, my district alone, is even twice, is almost as large, if not larger than other smaller provinces. And for this to handle the whole of Isabela, Bulacan, Tarlac, and Pampanga can actually fit inside, and that's how big the province is. It's the biggest province now, with the Palawan being cut into 3, and there are islands. There are thousands of islands. If you put them together, they're bigger. But more so, Madam Chair, it is really imperative that I fight for this, to have the bed capacity increased to 500 now, because of what we have seen in the pandemic and the flooding, that massive flooding that hit my district in the province of Isabela and Cagayan. Every time there is a news report, Madam Chair, Mr. Chair, that the Cagayan Valley region has been hit, they think that it is only the Cagayan province that was hit. But more so, my district, if you compare it to a bathroom, the first drainage and the only drainage that pours on the waters of 38 tributaries from Ifugao, Magat Dam, Chico Dam, from Vizcaya to the 6 districts of Isabela, to the Sierra Madres and Cordilleras, funnel to my district. And that's why 7, our city of Ilagan and 6 of my towns were left to become islets. Islets like in the ocean, small islets in the oceans where we don't even see roads, but just tops of trees and tops of roofs. And so it is very, very much imperative for us to hopefully get the support of all my colleagues to support my bill to increase the bed capacity to 500 now instead of 300, Madam Chair. And with this, I apologize. I will have to leave actually your Zoom to cater, because we, after 3 to 4 days, a lot of receding flood waters here in my district. We still are prevented from going to other places because of the mud that has filled the roads and bridges that are still unpassable, and we're doing airlifting and road clearing right now. And so I do apologize for my looks now and my presentation. And I hope that my bill later on, when you tackle it, will be approved by the committee. Thank you very much, Mr. Chair and Madam Chair and my colleagues and everyone else. Chair?
Yes.
Yes, thank you very much. That's my piece, and hopefully you can continue with the agenda, and maybe when you tackle my bill, Mr. Chair, I hope that my measure and bill and amendment will be approved by the Committee on Health. Thank you.
Yes, Congressman Tony Pet, we will take note of your bill 6539, but we will now go back to the bill at hand, the National Health Security Council Act.
Thank you. Permission to leave, Mr. Chairman, because I'm doing relief operations as we speak.
Yes, take care, Kong Tony Pet. Mr. Chair.
Yes, Congresswoman Ging Swansing.
Yes, I can feel the passion of our chairperson, and this bill, I believe there is already a substitute, unnumbered substitute bill. After the presentation of my BFF chairperson, Helen Tan, it is a very informative, educational, and detailed presentation. Can I already make a motion, Mr. Chair?
Mr. Chair.
Yes, Kong Kaloy, you're recognized.
With the kind indulgence of the Honorable Swansing, I suppose she is already moving for the approval of the substitute bill. But before we have to go into that, with the kind indulgence of the sponsor and chair, Angelina Tan, may I propound just a few clarificatory questions, if the chair will allow.
Yes, Kong Kaloy.
Okay, salamat Mr. Chair. No? I thank the Honorable Angelina Tan for sponsoring this very important bill. No? Ito talaga yung isang malaking leksyon, aral na nahugot natin siguro dito sa pandemya ng COVID. And as I agree with the main sponsor na sabi nga ng mga experts, this COVID-19 pandemic will not be the first, nor this will be the last pandemic that probably we will experience in our lifetime. No? For many of us, this is the first experience that we're having now. No? Hindi naman kasi natin naabutan yung Spanish flu pandemic. No? So talagang napakalaking aral nito. No? And even the Honorable Chair Tan can remember during our hearing in March, before we went into a lockdown, in fact, we criticized then the health secretary. No? Napaka-late nung declaration niya ng health emergency, despite the fact that he already have work under existing laws to immediately declare a health emergency as early as January dahil meron ng namatay na victim of COVID-19. And that could have given us a lead time in the preparation kung as early as January ay meron ng declaration of health emergency. Now, in relation to that, Mr. Chair, so talagang napapanahon na merong isang, I think, a body that will look into this. No? Ngayon kasi, nakita natin dito sa creation ng interagency task force, at least to us, nakukulangan tayo dyan dahil lang nakita natin hindi na mamayani yung medical science and health framework, no? Dito sa pag-responde natin sa pandemya. No? In fact, ang aming main criticism dyan during the first months of the pandemic, mas namayani yung militarist solution. No? Between March and April alone of this past month, instead of conducting mass testing, for example, ang nangyari, nagkaroon tayo ng mass arrest of our kababayan. No? Mga 30,000 ang nahuli dyan for different supposed violations ng mga guidelines imposed by the Interagency Task Force. No? And in fact, there are a lot of cases now being dismissed by the courts because they are filing charges based on a wrong law. No? Yung non-reporting daw of contagious diseases kung mahuli ka sa daan na wala kang face mask. No? But be that as it may, Mr. Chair, no? Gusto ko lang itanong sa main sponsor natin, no? Mainly doon sa Section 8, the composition of the Health Security Council. No? Kasama doon yung sa composition is the National Security Advisor, the Director of NICA, no? And it says that the Secretary of Health shall be the permanent chairperson of the Health Security Council with the Secretary of National Defense as co-chairperson. I understand they were included in the composition of the members since this council also covers bioterrorism, chemical attack, nuclear attack, and attack of radioactive materials, no, as defined in Section 4K, no, Public Health Emergency. To this representation, ang tingin po natin, correct me if I'm wrong, Mr. Chair, no, and the good sponsor, itong bioterrorism, chemical and nuclear attacks should no longer be included in this bill, no? Since these are already security issues mainly, no? And not health issues. No? These are issues beyond, for example, the scope of the chair of the Health Security Council, the Department of Health, no? Which is the Secretary of Health nga. Also, to this representation, parang nakikita natin these items were inserted under the definition of public health emergency, apparently just to justify the inclusion of the Secretary of National Defense and then as co-chairperson, and to include the other security officials, no, in the composition of the council. So that's my first point of clarification, Mr. Chair, no, and to the good sponsor. Second, uubusin ko na lang ho lahat para dire-diretso na. There is also a proviso that the Philippine Health Security Council will meet, no, at least once every quarter on dates and place to be determined by the said council. Every quarter, is that really necessary, even in the absence of a health emergency? Kasi kanina, nabanggit ng ating kagalang-galang na sponsor, napakarami ng composition, no? Lahat na secretary ng all departments and major agencies, even members from the civil society organizations are included in the council, no? So can you, I am just wondering, meeting every quarter, is that really feasible, especially if there is no health emergency? So that's the second, no? And finally, again, no, related to the first question ko, doon sa organization at the local level, no? Again, there's a proviso in section 12 that the chairperson designated will be the chief executive of the local government unit and the highest ranking officer of the Armed Forces of the Philippines assigned in the area as member, no? Again, I'm raising these issues, no, in relation to the first, no, ano bang role talaga dito, no? Dahil nang nakita nga natin dito sa setup ngayon, halimbawa itong interagency task force, ang karamihan dyan, well, they are already, they can argue that they're already civilians, no, but they are former, in fact, former generals, no? So yung namamayaning concept, no, on how to address these issues, for example, COVID-19 pandemic, ay talagang on the military aspect na solution, no? So natatabunan as always, so sa tingin natin o sa tingin ng katinatawang ito, yung health, scientific and medical aspect of responding to the problem. So those are the three major issues na gusto kong malinawan, Mr. Chair, no, and to our good sponsor, Chairman Angelina, before we accommodate with the kind of indulgence of the Honorable Sonsi for her motion. Thank you, Mr. Chair, and I hope we can get a good response from the sponsor.
May we hear from the principal sponsor, Chair Helen?
Thank you, Mr. Chair. Thank you, Representative Carlos Zarate, on your queries. No, to answer your question on why the bioterrorism and what else, the other one that you mentioned is included in this bill, because we're looking not only on the health aspect, but the security threat that may affect our health. No, as defined in Section 4, health security refers to the activities required, both proactive and reactive, to minimize the danger and impact to acute impact of acute public health events and endanger people's health. And we know that those security threat may endanger the health of the public. As to the meetings that we require that they conduct every quarter, because we don't want to be in a position wherein we react on the circumstances or events. Ang nakita po natin sa pandemic ay sa ngayon ang pagtugon ay nagre-react tayo sa mga nangyayari. So we tasked the council to create a national security action plan that would include a capacity building, and we are looking into a preventive aspect, no. So hindi lang naman siya paghahanda na kung kailangan nandiyan na yung anumang threat meron tayo, but it should be a continuous process, no. So yun po yung isang natutunan natin with pandemic. While You're asking why the national defense, no? Actually, isa ito sa isipan din ng technical working group if it should be the DILG or national defense. But because of the title itself, no, ang ating kinikreate ay Philippine Health Security Council, and we wanted to have a Philippine Health Security National Action Plan down to the barangay level. It would be good if the national defense will be on board in the creation. But of course, the DILG, as I've mentioned earlier, it's a whole of nation approach, no? Kaya kung mapansin po ninyo, we have 67 members kasi yun ang nakita po natin na problema ngayon sa COVID-19 pandemic. Isa-isa ang pagtawag sa bawat ahensya. May kanya-kanyang mga ibinababa na mga polisiya. So yung coordination and communication ay naging isang malaking problema. So I hope that answers the question of our Representative Sarate. If my one of the author wanted to add, Representative Rufi Biason, I think he's on board. He can add to my answers.
Yes, Madam Chair, if I may. Yes, Madam Chair, as to the query of why there are there's a mention about chemical, biological, radiological, and nuclear weapons, etc. Because the overall objective of the bill really is to cover all types of health emergencies. Because in case of a biological terrorist attack, for example, such weapons target the health of persons. And that is why it is included in the concept of health security, because this is in the overall framework of national security, which is defined as being a state or condition wherein the people's welfare and well-being and way of life is enhanced and protected. So all threats to the health and safety of the people is a matter of national security and public health security. That is why it is envisioned to be part of this bill. This bill is not a direct measure to address the current pandemic only. In fact, as an author, back in 2003, after SARS, I was a member of Congress then. I had already filed a bill, the creation of the Public Health Emergency Council, which unfortunately was left unattended to by Congress for more than a decade. And it was only through this experience of a pandemic that we've given attention to public health security. Although the benefit to that is that we now have a specific experience to draw upon to include in those proposals, and hence we have this bill. As to the inclusion of the Department of National Defense, we all know that the first responders, really the first capable responders is the military, because they have the manpower to mobilize. They are organized. We can immediately deploy them. And as you can see now in Cagayan, the response really was, we were depending on AFP military assets to get things going. So the inclusion of the DND, we believe, is a necessary component, especially that we are also including into the concern of the body of health security, the aspects of man-made threats to health, such as bioterrorism and the use of biological weapons and even nuclear weapons. So that is the overall concept and logic why the DND is included in the council. That would be all, Madam Chair. Thank you.
Okay. Any other
a follow-up question?
questions?
Just a follow-up, Mr. Chair, if I may be allowed.
Congressman Caloy?
Yeah, yes, Mr. Chair. I understand itong bioterrorism, nuclear attacks involve national security, no? So if I may inquire from the Honorable Biazon, wala bang conflict ito? We already have a National Security Council to address on this issue of security threats, no? Including even possible terrorist attack by bioterrorism, nukes, no? Nuclear attack. So, wala bang conflict ito dito sa dalawang, kung mag-create na naman, if this Health Security Council will be created, wala ho bang conflict, no? On this issue, Mr. Chair?
Mr. Chairman, hindi po natin nakikita na magkaroon ng conflict because hindi naman po sila parallel. The participation of an agency like the DND's Health Security Council is focused specifically on health threats or health issues, while the National Security Council is the overall, it encompasses the overall aspects of national security, which would include territorial integrity, sovereignty, protection of the whole state. Whereas the Health Security Council is focused on the health issues. Of course, on the aspect of the national security strategy, that would emanate from the higher level, which is the NSC, and would have inputs to the health security policy that we would be crafting under this Health Security Council. So we don't see a conflict, but we see that they would complement each other, or the Health Security Council would be focusing on a specific aspect of the entire national security issue.
Thank you, Mr. Chair. And final clarificatory question, Mr. Chair. Meron bang model nito in some other jurisdictions, Mr. Chair, this kind of setup, the Health Security Council that we are proposing as we speak now? Is this patterned after the CDC in the US or some other jurisdictions, Mr. Chair?
To mention, Mr. Chair, an example which is United States and Australia has that Health Security Council and the action plans.
Thank you, Mr. Chair, for the opportunity to clarify some issues on this particular bill.
Okay. So are there no more questions?
So, Mr. Chair, if there is no more questions, this
Congressman Swansing, yes.
Mr. Chair, this unnumbered substitute bill is a result of several meetings and consultation of the technical working group. I move for the approval of the unnumbered substitute bill to House Bills number 6081, 6493, 6618, 6624, 6650, 6671, 6688, 6719, 6746, 6770, 6932, 7014, 7593, and 7713 without amendments, Mr. Chair. So move.
There's a motion to approve the substitute bill. Any objection?
Chairman, I second the motion.
The motion is seconded. Hearing no objection, the motion is approved.
Congratulations, Chairperson.
Congratulations,
Helen.
Madam Chair.
Mr. Chairman,
Yes, Congressman Rodriguez.
as I congratulate the authors of the bill, the consolidated bill, may I request that I be included as one of the authors of this approved substitute bill. Thank you, Mr. Chairman.
Congressman Tan, Congresswoman Tan.
Yes, Mr. Chair, it's an honor that Representative Rufus Rodriguez is interested on this measure.
Thank you, Mr. Chairman, Madam Chair. Thank you.
Madam Chair, I'd like to thank, with your indulgence, I'd like to thank your honor for, and of course, our colleague here, Congresswoman Ging Swan Singh, for taking good care of all the consolidated bills. That's all, Madam Chair, and thank you so much, and congratulations again for being back.
Thank you, Congresswoman Robes. We now move to COMSEC.
Sir, we now move to the Medical Reserve Corps bills, sir. Yes, sir.
The Medical Reserve Bill, House Bill House Bill 6081 by Congressman Biason.
Mr. Chair, we're going to present the substitute bill, sir. So it's an unnumbered substitute bill.
COMSEC, are we done with the...
Yes, sir. We are already done, sir, with the National Health Security. We are going to present now the Medical Reserve Corps unnumbered substitute bill, sir. So maybe, sir, we could proceed.
Oh, sorry.
Yes, sir.
Asan na ba tayo?
Apo.
House Bill. Sorry, I don't have the copy.
Yes, sir.
Sali.
Sir,
sorry, I don't have.
Mr. Chair. Mr. Chair.
Are we going to tackle House Bill?
Unnumbered substitute bill siya dun sa medical corps.
Mr. Chair, excuse me.
Yes, Congressman Alan.
Alan Nicleo po. Opo. Mr. Chair, can we just stick with the original agenda? Because the local bills are more faster to tackle than the national bills. So, if we permitted, Mr. Chair.
With your indulgence, Congressman Alan, the chair has requested to tackle first the national bill because the chair has a meeting to attend to after this.
All the bills, sir? All the national bills, sir?
The national bill.
Okay.
Mr. Chair, yes. Just want to inform our Representative Alan Ecleo that we are about to present the substitute bill for the Medical Reserve Corps. If I may, Mr. Chair, I can present the substitute bill as one of the principal authors of this bill.
Yes, Chair Helen, you may now present the substitute bill on the Medical Reserve Corps.
Thank you again, and magandang umaga po muli sa inyong lahat. I believe that the rationale for the Medical Reserve Corps bill is clear on everyone, which is to ensure the delivery of health services to Filipinos by bolstering the existing health workforce and support emergency response efforts in the country. The bill seeks to complement the minimum population-based health service components of the various levels of health systems in the country, especially in times of public health emergencies. With this in mind, I would like to stress that this substitute bill, as it is with every measure that we pass in this committee, is a product of consultation and close coordination with relevant agencies, experts, and stakeholders. It also reflects the cautious blending of views and position of different authors on the subject. Overall, the bill mirrors the paramilitary organization of medical reserve in order to mimic the rapid deployment or mobilization of medical volunteers. This is made clear under the Declaration of Policy, which partly states that the state recognizes the need for a reserve force of part-time, highly skilled and medically trained professionals and volunteers who can be mobilized to maintain surge capacity of the country's healthcare system and provide assistance as may be needed in times of health crisis. Pursuant to this, it is the policy of the state to maintain a strong, proactive, and responsive healthcare system at all times, which can be expanded rapidly by a well-trained and well-equipped medical reserve corps in times of public health emergency and health threats. Towards this end, the state shall enhance the capacity of the nation to produce and call on the needed manpower and expand its human health resources in times of disasters and health emergencies, both of national and local scale through the mobilization of the MRC. The hierarchy of call under Section 3 are the following: licensed physicians to include those who are retired and those who are no longer practicing in the hospital setting. The Department of Health may coordinate and collaborate with accredited integrated professional organization or accredited professional organization of physicians for the engagement of private practitioners. Medical students who have completed their 4 years of medical course, graduates of medicines, and registered nurses who may be issued by the Secretary of Health with a limited and special authorization to render medical research pursuant to Republic Act 2382, otherwise known as the Medical Act, and licensed allied medical professionals. The MRC shall be so organized, trained, developed, and maintained as to ensure their readiness to immediately respond to the call of service or to the call to service. These volunteers will serve under the Health Emergency Bureau of the Health Emergency Management Bureau of the DOH, which shall organize, structure, and man the MRC using a paramilitary setup and in such a manner that it is necessary to make it effective, efficient, and responsive to the local and national disasters and other health emergencies under such rules and regulations as the the Secretary of Health may prescribe. As provided under Section 5, recruits will have to undergo a compulsory basic training for disaster and health emergency response and organization and structure of the MRC for purposes of familiarization. After that, they will be made to continue their training with the AFP and NDRRMC to reinforce their skills. With this, they are now ready to be mobilized by virtue of the authority of the Secretary of Health upon the recommendation of the Director of the Health Emergency Management Bureau or upon the request of the national government agencies or local government units in order to meet the needs of the public health emergencies, whether of local or national scale, and for other purposes deemed necessary to respond to threats to public health. The MRC may be mobilized partially or in full as may be necessary. The DOH shall promulgate the specific mechanisms by which deployment is efficiently implemented, including the organization of the Corps to be deployed, their territorial assignments, how deployment orders are communicated to each other of the Corps, and to which mobilization center they will report. The MRC may also be deployed in case of the declaration of state of war, state of lawless violence, or state of calamity. Section 12, 13, and 14 provide for benefits under the service such as salaries and allowances, medical care, hospitalization, and other privileges and benefits during the period of mobilization. To give teeth to the enforcement of this proposal, Section 19 provides the necessary penal provisions for failure to respond to the order of deployment without any justifiable reason. On behalf of the authors, who work hard to harmonize the various measures on the institutionalization of the Medical Reserve Corps in the country, I am asking the support of this committee for the immediate approval of this substitute bill. Maraming salamat po, Mr. Chair.
Thank you, Madam Chair. Any reaction from the members?
Mr. Chair.
Congress, is that Congressman Kaloy?
Again, if
I can see. Yeah, Congressman Zarate.
Yes,
you're recognized.
Again, if the good sponsor will allow a few clarificatory questions before we will submit for approval the proposed bill. May I be allowed, Mr. Chair?
Yes, go ahead, Congressman Zarate.
Thank you, Mr. Chair. Again, I thank the author principal author for sponsoring this bill. Ilang katanungan lang po. In section 11. Again, yung concerns ko as raised ko rin doon sa ibang bills pa natin in this nature. The perceived possible militarization of our supposedly medical and health bureaucracy, because for example in section 11 magmobilize or ang kakatulungin dito ng MR in the structure of the MRC is the Armed Forces of the Philippines, and siguro doon lang din sa paggamit ng term na paramilitary kasi in this past several years, nagkaroon kasi ito ng connotation na yung paggamit ng term na paramilitary ay they are involved in human rights violations. So I hope this good sponsor can enlighten us on this. Itong concern na further militarizing as an otherwise civilian agency or bureaucracy to respond, for example, to a problem like when there is a declaration, a state of war, or there is a national calamity and other situations, Mr. Chair. That's my first concern, Mr. Chair, in section 11. And second, ituloy ko na rin, Mr. Chair, there are three instances where the Corps will be mobilized. First, during the state of war. Second, lawless violence. And third, calamity. Ano po ba ang pagkaka-define natin? Kasi I did not see any definition here. Nung sitwasyon where there is a lawless violence. And finally, doon sa section 19 sa penal provisions, while the first two penalties pertains only to rendering community service, yung third penalty is very, I think it's harsher, because it imposes a penalty of imprisonment. Now, it says here, the DOH, without any justifiable reason, shall, upon conviction by a civil court. Ano po ba yung possible justifiable reasons na ang isang medical practitioner can refuse being mobilized, being sent, for example, to do services during a times of war, lawless violence, or calamity? So I hope we can be enlightened, Mr. Chair, and to the good sponsor on those three issues. Maraming salamat po.
Congressman Helen, you may now respond.
Thank you, Mr. Chair. Regarding doon sa first question of Honorable Carlos Zarate on adopting a paramilitary structure, as mentioned by Representative Biazon, because na-recognize po natin yung capability of the AFP on responding to the threats, calamities, and so on. so forth. So siguro po, as an author, I'm amenable to use another term similar to paramilitary, just to veer away doon sa word ng paramilitary. But ang intention lang po nito is that nangangailangan pa rin po tayo ng tulong kung if we want to strengthen the MRC that we are creating doon sa skills, no, na meron po yung ating AFP, no, sa pag-respond po doon sa ating mga disasters and emergencies. With regards to your question on the definition of the lawless violence and what's the other one?
War, violence, and calamity.
Yes, although we didn't define it at the definition of terms, but we can refer on the definition stated in the law, in the Constitution. Same lang po, no? But we can define it. As to the offense, on Section 19, I agree with your observation, but we are in a premise kasi that those who are enlisted in the MRC agreed on the contract, and yung pag-call po sa kanila at the time of need, kung hindi po sila mag-respond, parang nakita po natin na mawawalan ng teeth yung batas kung hindi maglalagay ng imprisonment. So yun yung intention. But if you have any suggestion, any members or Honorable Sarati has a suggestion na mas okay, without imprisonment, the chair is amenable po to amend such recommendation. Or
yes,
Congressman Zarate.
Thank you, Mr. Chair. Just a follow-up, Mr. Chair. Yes, doon sa thank you for accommodating that concern, no? Doon sa una of militarizing the supposedly civilian agency. In fact, if gaya nung nabanggit nyo kanina, yung the other bill, no? I'm also wondering why not the ILG, for example, no? Kasi mas marami siyang presence talaga in all the localities, no? And, as a civilian agency, supposedly, no, although I also believe that the ILG is also a militarized agency, but theoretically as a civilian agency, I think the ILG is even proper, no, to do all these things, no, in helping organizing the core. So that's the first. Second, dun sa concern ko dun sa penal provisions, because this will become a law and there are penalties imposed. So dapat we have to set a standard, no? What are these justifiable reasons that a member of the medical corps can invoke, for example, in not responding to a supposed emergency, like for example, war, lawless violence, or even calamity, no? Kasi otherwise, kung walang standards na nililay down natin dito, halimbawa, yung mga sinasabi nating consensus objector, I will not, even if I'm a doctor of medicine, I will not serve there because it's against, for example, my belief, no? Na ipadala mo ako doon sa isang area, just a theoretical, no, na dinideclare that there is a lawless violence. I cannot serve there. No? Then, because I refuse to serve under this law, dahil wala namang standards, sabi lang doon, justifiable reasons, so that will be subjected to a vague interpretation of what is a justifiable reason. Some may say that my reason for objecting is not justifiable, so I can be penalized. So yun lang po ang gusto kong ilinaw. Siguro mas, if I may suggest, no, I don't have a specific language now, no, but if I may suggest to the principal author and the others, na baka lagyan natin ng specific standards to be, dahil may penal provisions po rito, and it will in the future, if this becomes a law, pwedeng makulong, no, yung isang tao, or he can be sent to do community service just because he objected or she objected to be deployed. So yun lang po ang mga concerns ko, and hopefully this will be addressed by the committee as well as by the sponsors. Thank you, Mr. Chair.
Mr. Chair.
Yes, Congresswoman Tan.
Yeah, if I may request to Representative Zarate that we approve this bill subject to amendment and style, and if we can request that he wrote a letter to the committee for consideration on the recommendation on the said issues that he mentioned.
Madam Chair.
Congressman Biazon.
Yes, Madam Chair, just to respond to the issue. The matter of conscientious objectors are applied basically in a scenario where there is a draft, wherein persons are mandatorily called to serve. The Medical Reserve Corps is a volunteer service. So people will be signing up because they want to serve into the Medical Reserve Corps. The conscientious objector, if we give an example, in the United States military experience, these are instances when men or persons are called to enter the military service, to serve in a war, for example. And conscientious objectors are given the option of not bearing arms, but instead they are given assignments such as a corpsman or a medical corpsman, wherein his duty is not to fight against the enemy bearing arms, but rather save lives as first aiders. That is a concept of how conscientious objectors are dealt with in other militaries. But in this case, the Medical Reserve Corps is a volunteer service. So those who are not willing to serve as medical personnel are not required to join the service. So it may not exactly be appropriate to raise the issue of conscientious objectors. Kasi ang trabaho nga nila is to serve as medical personnel. So it would be strange for them to volunteer to join a medical service unit and object to being used in that unit just because it's under the military or it's a paramilitary. With regard to the penal provision, it is really the failure to respond. If you signed up, you're expected to respond. And if you fail to respond, that's why there are penalties involved. Of course, if the call is to put in the justifiable reason for refusing to serve, then I would agree that's one thing that we can improve the bill on. And as suggested by the chair, that specific provision can be further discussed. Thank you, Madam Chair.
You are saying, Congressman Biazon, that the imprisonment stays because you volunteered, but you reneged on your promise.
In a way, it's like that. And the service isn't really to, even in times of war, the Medical Reserve Corps, the duty is to save lives, actually. And it really is strange if they will sign up knowing that it's the purpose of the unit is to deliver medical service, and then they refuse to do so in the appropriate time.
I think that's a reasonable penalty.
Mr. Chair,
again, on my part.
Mr. Chair, just a final point. Yes,
Congressman Zarate.
True that it's a voluntary in nature, no, and I suppose they will have to sign a contract or any document for that matter. And if you refuse later on, tingin ko napaka-harsh no ikulong mo siya. Even in normal circumstances, if you violate the contract, you will be liable civilly, probably. But para ikulong ka, that's, I think, harsh. You will be penalized for that, no? And sinite ko lang yung conscientious objector as akin to that. I'm not saying that that is really the reason, but there are some reasons probably in the future, no, when this becomes a law, that a medical practitioner, even if he volunteered, he has a valid reason not to be drafted or not to be deployed to some areas. No? And because of that, kung hindi natin set yung grounds dyan, you will be imprisoned. No? So that's my point, Mr. Chair, no? That I think it's kahit isang araw ka na ikulong dyan, I think it's not justifiable. No? Just because you objected, no? Even granting that in the first place you volunteered, no? Because there are circumstances may change, and we have to acknowledge that. Na, kung nagbago yung mga circumstances before nag-volunteer ka tapos ayaw mong ma-deploy, then I think that has to be accepted also by and reflected in this law, proposed law, Mr. Chair.
Mr. Chair. Mr. Chair,
yes, Congressman Barzaga.
Well, good morning. Unang-una, I fully agree with the wisdom and the objectives of the Medical Reserve Corps Bill. After hearing the discussion made by our colleagues, especially Congressman Salate and Congressman Lupi Biason, I have to admit that I was not able to carefully study all the provisions of this consolidated bill. And therefore, while I do not object to each passage in the committee level, I would just be reserving my right to interpolate during the presentation of the bill to the plenary. I will be physically present so that I can clarify some of the provisions which our colleagues are contesting or making some reservations right now. And that is all, Mr. Chair.
Thank you, Congressman Barzaga. Duly noted.
Mr. Chairman.
Yes, Congressman.
Rufus, Mr. Chairman.
Congressman Rodriguez, you're recognized.
First, belatedly, I would like to greet you a happy birthday. I should have said this early on.
Thank you very much,
to our
Congressman,
yes,
my idol, Congressman Rufus.
And we hope that Batanes was not really hit badly by the previous typhoons that visited us.
Fortunately, we were not.
Thank you. Thank the Lord. Thank you, Mr. Chairman. Mr. Chairman, upon second consideration of the bill, I am one of the authors of the bill. I am of the opinion that we should delete criminal liability in the bill. This is a volunteer organization. It is something that our people will look forward to be able to serve voluntarily. And if there is a criminal liability, then it is something that is quite enforced. It's not anymore volunteer. There is always that possibility that, in fact, it might have also a chilling effect on volunteers. If volunteers themselves can go to jail. And so I seek the consideration of our body. The intent is very good. It can be successful without any criminal liability. After all, during the service, if there is a gross negligence resulting to a crime, then there will be liability on these volunteers themselves in accordance with the revised penal code. So I believe that there should be more a compassionate approach to this, and that there should be no criminal liability. There may be a violation of there's a contract. There may be some civil liability if that is so also, that can also happen. But criminally, to make a person criminally liable for not following orders on that case may be really harsh. So therefore, I agree with Congressman Carlos Zarate that we just remove the criminal liability as existing in our proposed substitute bill. Thank you, Mr. Chairman.
Mr. Chair, may I, Mr. Chair?
Congresswoman Sonsing. Hi, sorry. Congresswoman Robes, sorry.
Good morning, good morning. And I'd like to make my manifestation with the desire and of course the statement of my mentor, Congressman Rufus Rodriguez, because as a chairman of People's Participation, usually when you do volunteerism, it is actually with the heart, compassion, and passion. So I certainly agree with them that may we just do it on a volunteerism side. Actually, alam niyo po, sa lahat po ng akin nakausap sa aking komite, na lahat po na nagtutulungan, lumalapit at talagang yung mayakap sa pandemyang ito o sa paghihirap ng isang tao, hindi mo na kailangan silang itulak pa o sabihin na ganito. Minsan o kadalasan wala pang bayad. Kaya nga po volunteerismo. In this, Mr. Chair and of course, Madam Chair, let me first, of course, give my support to this bill since I'm also a co-author. At maraming salamat for showing a diagram of this because it opens hearts and minds of our people. And Kong Sarate, maraming salamat. God bless you all. Thank you, Mr. Chair, Madam Chair.
Mr. Chair.
Congressman Barzaga.
Well, I fully agree with the sponsor of the bill, our chairperson, that we should put more teeth to the bill. If there will be no penalty insofar as the volunteers are concerned, a situation might arise that there are volunteers, there is already a need, but nobody is working. After all, we did not compel them to be volunteers. However, once they voluntarily agreed, it carries with it responsibility. And if they fail to be responsible for that voluntary obligation, I believe that they should be liable, in order that this medical corps would have some substance and meaning in case of calamities and even in war. It is true that there is reckless imprudence, which is a criminal offense, but it presupposes that an act has already been committed. Which act is considered as a reckless imprudence? Anyway, these are some of my reservations. And whatever happens in the final version of the bill in the committee level, I would be reserving my right to discuss on this issue. Thank you very much, Mr. Chairman.
Thank you. So do we now decide on whether to remove or to retain the imprisonment penalty now or at a later date?
Mr. Chairman, just an additional.
Yes, Congressman, is that Congressman Biason?
Yes, Mr. Chairman, Congressman Biason. Mr. Chairman, we have to distinguish this when we say it's voluntary because people sign up for it. But it's different from a current situation wherein medical professionals, let's say, gather as a group and then they offer their services in partnership with government. When these medical professionals sign up for the Medical Reserve Corps, once they sign up, the signing up is voluntary, but when they're inside the organization, it is deemed that they are part of the organization and are obligated to comply with orders. Because if we are to dilute the obligation that they have, then we might as well touch on the provision let me just browse through this. On the provision which gives the president the authority to order the mobilization of the unit. Because there is a provision here which gives the president the authority to order the mobilization. So there must be a consequence to the non-compliance to the order of the president. Unless, of course, we wish to remove that provision as well. Because that would be a necessary thing to do if we are to dilute that obligation for them to follow the orders. Kailangan pati yung authority ng presidente, tatanggalin po natin. But then the unit is also envisioned to take action in times of war, in times of conflict. So would it then be wise to remove the power of the president to order the mobilization of the MRC during times of war? Because that is part of the envisioned function of the MRC. That would be all, Mr. Chairman.
So I go back to the question, do we now settle the penalty
Mr. Chair,
issue now
Mr. Chair,
or at a later date?
Mr. Chair,
Yes,
I have some,
Congressman Rodriguez.
I respond, Mr. Chairman. Volunteerism, Mr. Chairman, does not end with you signing up as a volunteer. In other words, even when the president would order the call and then the deployment or the activization, a volunteer can resign at any time. That is the concept of volunteerism. You can leave. You sign up, and then when you sign, it does not mean that when you sign up, you are not anymore a volunteer. The signing up means that you have the intent to join. But if there are policies that you may not like anymore, as a volunteer, you stay on as a volunteer, you sign up, and you have the right always to opt out of the volunteerism. If, for example, orders from authorities may not, in your conscience, be in line with what you want to do. And so therefore, even if you have signed, we cannot make them criminally liable. So we will make sure that there are many volunteers, and then if the volunteer is still, they have the opportunity to be out anytime. That is the concept of volunteerism. They are volunteers up to the time that they would serve. Now, they do not anymore agree with policies of those administering the medical corps. Then as a volunteer, you opt out from it. There is there is no compulsion for you to stay. You're a volunteer. So that is the main concept that I would like to propose, that we cannot have volunteers being liable criminally. Even if the president says so, if he does not agree, he leaves the entire organization. And that is what we would like to have. If you have a criminal liability there, then, and we approve this, then we tell our people that, okay, you volunteer, but then if you do not follow, you will be, this is not a military organization. Yeah. That is one thing. It's not a military organization that you have to obey all the orders. No, it's a volunteer medical corps. And in fact, the essence of this medical corps should be civilian in character. And that is why we have these provisions. So that should be the case. If there is a change in this concept of being civilian in nature, then we have a problem. No, we have the volunteers, we have the reserve corps in the military. Okay, they go. They can be called upon. They can also volunteer in the military. But this is really a medical reserve corps, and the concept of this is to be able for people, doctors, nurses, to be able to give their payback to the people. So yan lang concept of volunteerism and concept of the civilian nature of this. And therefore, I would really propose that we take this out. But as a soldier myself, a good soldier of the committee, whatever is the decision will be. But to put it into a proper perspective, I now move for the amendment of this so that we can decide. On this, because to me it is a very good. Whatever the decision of the membership will be, okay. I move that we amend the substitute bill to remove all criminal liability stated in the bill. I so move, Mr. Chairman.
Mr. Chair, Mr. Chair. Mr. Chair. Mr. Chair, Ging Swansing po.
Congresswoman Swansing, you're recognized.
Yes, can we hear from the chairperson before we act on the motion, please?
Thank you. I'm about to speak.
Congresswoman Tan, principal sponsor.
Yes. Thank you, Mr. Chair. I am just one of the many authors of the MRC. While I agree on the observation of our colleagues on the criminal liability, again, as mentioned by Representative Barsaga earlier, ang tinitingnan lang po natin dito is that we did not defeat the purpose of this bill na magawa natin na isang batas. As mentioned earlier, volunteerism po ito. Ang enlistment ay on voluntary basis. Sila po ay bibigyan ng remuneration benefits and all other benefits na kailangan. I agree yung imprisonment, sir, although hindi ko to proposal, it does not come from my own bill, ay i-drop po natin. But siguro po ay bigyan natin ng corresponding penal provision siguro for not complying on the expected service na hinihingi sa'yo when that time comes, no? Kasi parang ang nakikita ko po, kung community service, okay din po sa akin. Kung first or the rest of the offenses ay community service at walang imprisonment, yes po, I agree with that, no? Pero siguro kailangan lang din in return kasi before naman po ma-enlist na recognize ng isang individual yung responsibilities and obligations that they need to give should that time arises. So I agree with Representative Rufus Rodriguez that we drop that provision on criminal
imprisonment.
Mr. Chair.
Yes, Congresswoman Sonsing.
If Chair Helen is already done, can I say something because I am also one of the authors of this bill?
So are we now settled on the
Mr. Chair, can I say something?
Related, okay, Congresswoman Sonsing.
Yes, actually, Mr. Chair, this is not also part of my bill, no. But I can also understand Congressman Biason on his point, and of course, Representative Zarate and Representative Rodriguez. But just to give teeth to this bill, can we ask them if, kasi to me, it's the Medical Reserve Corps will be receiving compensation and allowances. So parang is this voluntarism? Kasi ano to eh? Kasi pag if you intend to be part of this MRC, parang nakalagay din naman, naintindihan din naman nung person that I am also bound for to be penalized, no, in case I fail. Kasi ang mangyayari dito, pag wala ng teeth itong batas na to, wala nang, baka naman member siya or how do you call them? Part siya nung Medical Reserve Corps, pero pag in times of need, baka wala nang mag-participate. So I can fully understand. So maybe what we can do is, can we ask Representative Zarate, wag naman siguro na natanggalin na lang tong penalty clause. Maybe we can reduce the number of hours or remove the imprisonment.
I think we all agree that there should be penalty. I think the issue here, Congresswoman Swansing, is the imprisonment as one of the penalty.
No, Mr. Chair, the way I understand it, gusto nilang i-drop talaga yung penalty eh. Kasi voluntarism ito eh. So parang to me kasi just to put teeth to the law, kasi yung point ko nga eh, baka wala nang matawag because lahat sila may reasons for not participating. So yun lang, Mr. Chair.
Mr. Chairman.
Congressman Biason.
Yes, Mr. Chairman. Under the bill, the government will be investing in the training of the members of the MRC. May investment ang gobyerno eh. Tapos, just like that, parang baliwala lang natin yung pag-sign up. The imprisonment part, it was not my suggestion. In fact, I don't have a bill na final na counterpart, but I signed up as a co-author because I saw the value of the proposal. So, nag-mention nga ni Kong Ging merong investment ang government dahil hindi lang doon sa salaries and allowances, it including the training, because part of the provisions is the training of these personnel. That's why the government has a reasonable expectation that these people will live up to their commitment. Besides, bago sila mag-sign up, although again, it is voluntary signing up, ang obligation nila na alamin ano ba ang kondisyon nitong mga isa-sign up ko di ba? Kaya wag po natin i-compare doon sa yung voluntary ngayon, magsa-serve sila ngayon sa during calamities and then on their own time, no? Iba to you're signing up for the reserves, just like the military reserves. When they are called upon to respond, to perform duty, may obligation. Gagaya ng sabi ko, in Section 8, the President is authorized to give an order for the mobilization of the MRC. So, yung walang penalty doon sa hindi susunod, parang hindi yata acceptable to the state yun. Dahil may
you are for retaining the imprisonment.
I'm open to changing the penalty, but there should be a penalty, I believe.
Yes, I think everybody agrees that there should be penalty. I think the bone of contention here is the imprisonment.
One possible, sir, penalty
I understand it.
One possible is a reimbursement of government expenses on him. That's one possible penalty. Thank you, Madam.
Mr. Chair.
Congressman Zarate?
Mr. Chair, I still support the earlier motion of Congressman Rodriguez. Kasi po, ang nilagay kasi natin dito, penal provisions. No? So this is now in the nature of a criminal offense. No? Because batas ito. Hindi naman natin sinabing administrative penalty ito. Hindi naman natin sinabing civil liability. No? I appreciate that Congressman, the Honorable Biason is saying na kung mayroong nagasto sa'yo, kailangan sigurong i-reimburse mo. No? Then that's in the nature of a civil liability. No? Pero dito kasi as it is now worded and as presented here, this is really partakes of a criminal penalty. No? There is a violation of a law. No? So liable ka. Even yung rendering community service, it's not automatic. No, kailangan mag-file ka ng kaso sa, if I understand it, sasampa ka ng kaso doon sa korte, no, in the nature of a criminal offense, violation of section 19, no, or doon sa particular provision on mobilization, and the court will impose you the penalty of, for the first offense, 120 hours of community service. So yun po ang mangyayari doon, no? Nagiging ang yung ng voluntarismo ay nagiging criminal na ngayon pag hindi ka tumupad, no? So it's different if it's just kasi kung titingnan niyo rito, meron ding ang next provision niyan is disciplinary and corrective proceedings, no? Administrative offenses committed by persons involved, etc. No? It's just an administrative proceeding, not criminal in nature. But here, the volunteer will be penalized, no, criminally. No? Kahit na hindi sabihin mo hindi imprisonment, pero criminal penalty pa rin yon. No? You will be penalized for violation of this law. So yun ho yung point ko doon. No? Kung totoo na mayroong ginastos ang gobyerno, kagatulad din yan ng mga scholars natin, no, na they signed up, pumirma sila, no, that's they will be sent abroad to study, at kung hindi sila bumalik rito and they have to refund, possibly that can be the liability that can be introduced here, but not in the sense na ikukulong criminally you will be charged because you have valid reasons of not in anymore, you know, complying with the deployment as provided in the law. So I hope this will be accommodated again, Mr. Chair, no, by the sponsors.
Okay.
Thank you, Mr. Chair.
Yes, I very praise there.
Mr. Chair.
Mr. Chair.
Mr. Chair, ikaw una. Sige. Mr. Chair, ako po muna. Sige. Just wanted to remind everybody that all of our volunteers have their license, medical license. So why don't we just put in just additional, probably if you approve this bill, because I'm also a co-author of this one, and I'm really very, very happy with the presentation, probably with the question lang of the criminal liability. Of course, we all this have yung PRC license. I think it could be a very good answer kung talagang meron silang pagkukulang or something else, kagaya ng ginawa kay a certain doctor, I won't mention it na, natanggalan ng lisensya. Then he applied for it. For those who are retirees, syempre, the Philippine Regularity Commission can take care of that. Baka lang po pwede natin consider that as their penalty. Yun lang po. Because ang ganda na po nung na-craft na bill, no? Maraming salamat po and yun lang po. Thank you.
Mr. Chair. Mr. Chairman.
Sir, nawala po ang signal ni Vice Chair Gato. May we ask? Yes.
Can I speak? Very little, very short.
Representative Barsaga, actually nawala po si Chair June Gato. Is anyone from our vice chairs? Who's our vice chairs present? Kung Barsaga,
well, vice chair. Yes.
Yeah, you can preside
this. Okay, thank you very much. Ang gusto ko lang i-emphasize the nature of the work to be done. They will be rendering duty in times of war, in times of lawlessness, in times of natural, or even man-made calamities. And therefore, because of their urgency of the work, it is expected na kinakailangang magtrabaho sila. And perhaps that is the reason why I agree that there should be punishment, including criminal punishment. Kasi urgent to times of war, lawlessness, calamities. Pagkatapos yung inaasahan natin hindi naman magtatrabaho, resulting to additional loss of lives, loss of property. And I see the essence and the importance of the proposal of Kong Rufus, as well as the Honorable Chairperson. Well, anyway, if we cannot agree, then we just make reservation about the penalty and discuss it during the floor deliberation, where all the members will be given their respective opinion, and thereafter we vote on the amendments, if any. Is there still anybody who
I agree, Mr. Chair.
Yes, Mr.
There
Chair,
is still anybody who want to speak?
Yes, Mr. Chair, if I may.
Yes, Congressman
Kabuchan po.
Kabuchan is hereby recognized.
Thank you, Mr. Chair. Mr. Chair, doon po sa bill ko, naka-reflect po doon yung penalty with the 6 months imprisonment. So, hearing the arguments dito po sa ating discussion, I would like to manifest that I am amenable to removing that 6 months imprisonment. However, kailangan pa rin merong liability or penalty doon sa magva-violate. And amenable din po ako doon sa suggestion ni Congresswoman Robes and Congressman Biason po. That's all, Mr. Chair. Thank you po.
Okay, the COMSEC is hereby directed to duly note the manifestation made by Congressman Kabuchan. Is there still anybody who wants to speak?
Thank you, Mr. Chair.
Mr. Chair, Dr. Magalong is raising her hand.
Yes.
Thank you, sir. Salamat po sa inyong lahat, Your Honors. Kami po ay non-government organization. Napakaganda po ng inyong talakayan at nakikita ko ang interes ng bawat miyembro. Ihabol ko lang po bilang isang doktor, wala pong problema magbolontaryo. Pagdating sa mga calamity, palagay ko po magiging problema yung pagsama sa pagtulong sa state of war and lawless violence. Mas doon po yung talagang magiging problema, posibleng umayaw. Kasi po, siyempre, talagang napaka-imminent ng death. Pwede kang mamatay. Pwede kang mamatay sa calamity, pero malayo yung posibilidad. Pero pagdating sa gera o kaguluhan, may hirapan po talaga. Ngayon pa man, siguro po, kung maaari lang mailagay o maipaliwanag sa batas, yung tamang kahandaan din po ng volunteers. Kasi po, ang karaniwang pag-aaral ng doktor, hindi po kasama yung paggamot sa gitna ng laban. Wala po yun sa medical curriculum. Hindi po nakahanda ang mga doktor at lahat ng health professionals na humarap sa laban. Iba po yung natututunan naming setup sa hospital. So kung magiging maayos po siguro yung paghahanda din nung volunteer at masisigurado niyang maproteksyonan yung sarili niya, posible po na hindi siya aayaw. At tungkol po sa mga penalties, siguro pwede din po pag-usapan yun o stipulate sa batas na ma-penalize lang po siya kapag nag-volunteer na, kasi di ba po itong medical reserve corps is like a pool. Hindi naman lahat matatawagan at one time. So kung merong event, tatawagin sino yung available at that time among the list, among the many members of this corps. So kung halimbawa at that point in time you already volunteered and at the last minute tsaka po kayo nag-withdraw, then probably doon may liability. Pero kung halimbawa sa orientation pa lang, umalis na, wala pa namang deployment, pero sa orientation and halfway the training is merong hindi nagustuhan, gustong umalis, nagbago ng isip, wala naman po sigurong liability yon. Baka po kailangan linawin din lang kailan mag-a-apply yung not necessarily no pag-ayaw sa deployment. At saka ibang usapin nga po, kung halimbawa state of lawless violence, like sa Marawi, magdadalawang isip din po talaga yung doktor. At saka maganda din po yung punto ni Congressman Biason. Dapat po maliwanag na hindi combatant yung health professional. I-deploy siya not as combatant. Kasi may sarili namang reserve po ang AFP. Kasi hindi rin po malinaw sa provision. Basta i-deploy lang siya kapag may declaration of state of war or state of lawless violence. Pero it should be clear na i-deploy po siya not as combatant para meron din po siyang kasiguraduhan na hindi siya hawak ng armas dahil hindi rin po kami na-train kung paano bumaril. And even sa pagtugon po sa medicine o tumugon bilang doktor, first aider in a combat field, that requires additional training. Wala po sa regular medical curriculum ang medicine in combat or surgery in combat. May special training din po yon. Ma-consider din po yon sa part ng training ng mga magpo-volunteer. Ihabol ko na rin po sa usapin po ng training.
Gosh, 1 minute.
Yes, sir.
You have 1 minute.
1 minute, opo. Ihabol ko lang po sa training kasi po ang nabanggit sa training is only on emergency preparedness. Pero kapag pandemic po ang pag-uusapan, meron pong special training din on disease surveillance and outbreak response. I guess that has to be stipulated. Kasi po, ang emergency response in general is not tantamount to emergency in general. Konting second, lang po, to the sponsor po, kasi nabanggit po to Congressman Helen Tan, Your Honor. Nabanggit niyo po kasi sa report kanina na kailangan din ng institutional capacity. Ang tanong lang po namin, natignan na po ba ang kakayanan o pagtugon ng mga LGUs sa Republic Act 10121 kung saan kailangan nila magbuo ng kanilang mga preparedness committee, response committee, rehabilitation and mitigation committee, at yung 4 na health clusters under the LGU health scorecard indicators po ng Department of Health, na dapat meron po silang 4 na cluster response teams, meaning para sa medical, nutrition, water and sanitation, and mental health and psychosocial service. Kasi po nabanggit nyo rin po yung institutional capacity building as one of the major findings na weakness ng mga national health system. Maraming salamat po, Mr. Chair.
Thank you very much for that information. Just for the clarification of the chair, will the voluntary members of the medical reserve corps intended to bear arms in times of war or lawlessness? Chairperson Tan is recognized.
Yes, sir. Actually, hindi, sir. Ito ay more of health responder po. So, hindi natin na-envision na siya ay combatant na makikipaglaban in war, no? Re-respond siya doon sa medical needs. Kaya kay Doktora Magalong, nakalagay naman po dyan, the reason why na-mention nga kanina, mag-i-invest ang government to train, no? Ibig sabihin, very important yung readiness of those enlisted, yung mga volunteers natin. Hindi basta pupunta dahil na-recognize naman natin with pandemic, no? The reason why maraming health workers ayaw din nila na mag-volunteer or even nga yung ating deployment program under the DOH, ayaw nila na ma-deploy sila sa hospital because of that fear. Because hindi ka confident on your skills and more or less siguro knowledge then on how to respond. And yun yung isa. That's why itong MRC will also complement yung National Health Security Act natin. As to the readiness of LGU, siguro po yung na-mention nyo kanina, na narinig ninyo is under the first bill that we approved, no? At na-recognize natin yung kakulangan po din talaga ng readiness ng LGU when it comes to those 4 factors na inyo pong na-mention or elements. Itong MRC, linawin ko lang, again, no, ang konsepto is magbo-volunteer ako, mag-enlist ako, nakita ko yung responsibilities and obligations, mag-undergo ako ng training, voluntarily gusto kong mag-undergo ng training, and then you are officially enlisted doon sa ating MRC. So when kung immobilize ka na sa panahon na kailangan ka, ay may corresponding remuneration, no? May benefits, salaries, and ano. Hindi katulad ng volunteerism that's happening right now na binibigyan lang natin ng special risk allowance pero maliit na halaga. That's one ay tinatask natin ang DOH to check on how much yung kailangan talaga nila and kailangan talagang pondohan ng national government. On top of that, hindi tumitigil yung kung ikaw ay existing na or meron kang trabaho talaga na existing, hindi rin tumitigil yung sweldo mo doon kung saan yung iyong official na trabaho. So, siguro ang pinagdedebatehan talaga natin dito yung penalty. Again, ako personally as an author, I don't want then also a criminal liability. But we wanted some parang obligation naman as a member of MRC na we follow dun sa kung ano yung objective ng programa. So siguro po in the interest of time, Mr. Chair, we can approve na this bill subject to amendment, also adopting the recommendation of Representative Rufus Biazon that we drop the criminal liability but we retain the civil offenses.
Madam Chair?
Yes.
Yes.
Who
Hello.
wants to be recognized?
Yes. Good morning, honorable representatives of the House
You
and
are.
my
Please
fellow
identify
experts.
yourself.
Yes, I'm Dr. Cordero po, emergency physician representing Philippine Red Cross and the Philippine College of Emergency.
Oh, you are given 3 minutes.
Yes. May I just ask regarding Section 3 of the bill, if it's possible, because under the provisions, it is mentioned that only physicians, medical students who after 4 years finish their course, and licensed allied medical professionals. May we include medical allied professionals who are not under the licensure scope of the Professional Regulatory Committee, particularly competency-based professionals under the TESDA programs? Because the scope of this bill includes disasters and calamities that need pre-hospital personnel who will respond to the scene. In other words, paramedics, EMTs, yung mga field workers po natin sa medical arena. Unfortunately, with our present status with professionalization, they are not under PRC. Some of them are under TESDA, which is not licensed but certified, particularly the EMS personnel, EMTs, and even the contact tracers, wherein the training regulations just have been promulgated. May I request if this can be included in the medical corps?
What is the position of the principal authors regarding the observation and suggestion made by Dr.
Cordero po.
Cordero? From the principal author, our chairperson Helen Tan.
Yes po. Thank you, Mr. Chair. Dr. Jeremy, with due respect, no, we didn't include yung mga TESDA trained, no, kasi we recognize yung skills and knowledge na kailangan. That's why kung makikita po ninyo, ang nasa list natin are doctors and allied medical professionals and nurses, no, naka-define po talaga doon. But definitely yung ating mga additional health workforce that TESDA trained can help. But officially in enlisting an MRC, we excluded them, Mr. Chair, Dr. Cordero.
I see. Thank
Okay.
you.
Is there anybody who wants to speak before we finally put into a vote this bill?
Mr. Chair.
You are?
Mr. Francis Ray Subong po from the Philippine Guidance and Counseling Association.
You are given 3 minutes.
Okay. Thank you so much, Mr. Chair. With regards to the Philippine Guidance and Counseling Association as the Association of the Guidance Counselors in the Philippines, we would like also to ask clarification to our authors regarding the status of guidance counselors as mental health professionals. Kasi as of now, we are trying also to clarify our position because we are a unique professionals, because we are both career specialists and mental health professionals. So for example, in the AFP, guidance counselors are usually positioned in the teacher corps because again, we are trying to clarify based on Magna Carta for public school teachers, we are still part of the teaching profession. But with our professionalization, RA 9258, the Guidance and Counseling Act of 2004, and also with RA 11036 or the mental health law, which we are included as mental health professionals, then we are also quite in doubt if we can be considered as part of the medical corps as highlighted.
Just to clarify.
Yes po.
What role do you want insofar as the medical corps is concerned?
Because
ano ang gusto nyong dapat nyong gawin dito sa ating bill na to?
Mental health. We are on the aspect of mental health po.
So in times
Mr.
of war, in times of lawlessness, in times of pandemic, what will you do insofar as mental health is concerned?
We can assist in the response, and we can provide psychosocial support.
Psychosocial support to whom? To the victims or to the medical corps?
Both.
What is the comment of our chairperson and other authors?
Mr. Chair, may I be allowed, Mr. Chair? This is Ging Swansing.
Oh, yes, Congresswoman Swansing.
Yes,
The future governor of Nueva Ecija is recognized.
Ala, intriga yan, Mr. Chair.
No, okay lang. Because
thank you,
I'm
thank
hearing your name. Anyway.
Thank you,
what
Mr.
is your
Chair.
comment?
Yes, Mr. Chair, may I be allowed to answer, Mr. Francis?
Yes, of course, you are recognized.
Siguro, Mr. Chair, because in Section 3, nakalagay doon kung sino-sino lang yung kasama doon, ano? So, Mr. Francis, saan po kaya kayo nakalagay doon? Sa call to the Medical Reserve Corps Service, Section 3. Maliwanag po kasi doon, licensed physicians, medical students, licensed allied health professionals. Saan po kaya kayo nakalagay doon?
Licensed allied professionals po, Congresswoman. Just like with our psychologists. I could not speak with the psychologists because they have a separate organization, but somehow magkapareha kami ng psychologist on that position as allied allied health professional. That's why from our end we are also clarifying, because yung nakaangkla yung clarification based on the mental health law.
Okay. If you think you are included in licensed allied health professionals, then kasama kayo dito.
Thank you so much for the clarification, Congresswoman.
That's all, Mr. Chair.
Meron po bang gusto magsalita sa ating mga kasama?
Mr. Chair,
Please identify yourself.
Yes, this is Dr. Rafael Castillo from the Professional Regulatory Board of Medicine. I'd just like to make a couple of quick points, 1 or 2 minutes.
Yes,
firstly, yes, thank you, Mr. Chair. First point is that based on real life scenario as what has happened during the current pandemic, when the Department of Health needed a lot of volunteers, and they actually published this extensively, yet only a handful of volunteers actually signed up. So I foresee that this might be a problem which even this law, the enactment of this law, would still encounter. So a second point is that should there really be an exigency, an emergency, a national emergency, especially war or lawless rebellion, and there are not enough volunteers, I believe the government, invoking its police power, can require even non-volunteers to serve in such times, such that I would propose, Mr. Chair, that even that the training for preparedness of the healthcare professionals for times of emergencies should be made mandatory for all, volunteers and non-volunteers alike, so that in such instances, hopefully it does not happen to us, but in such instances when there is a national emergency and there are not enough members of the medical corps who can be tapped or mobilized to take action, then even non-volunteers can be required via the police power of the state to also serve, and they are ready because they underwent training on this. Thank you, Mr. Chair.
Thank you for that observation. Of course, we know the law that under the Constitution, in times of war or national emergency, we can call on every citizen in the interest of our country.
Precisely.
But our problem is that dumarating ang emergency, wala naman tayong nakahandang medical corps. And that is the purpose of the law. Of course, we anticipate that there might be problems regarding those who want to enlist. But in this particular case, we are also optimistic na marami pa rin naman tayong mga kababayan, including health professionals, who will consider the need to be of service during the time of calamity, during the time of lawlessness, during the time of war.
Yes, Mr. Chair.
Conditions of patriotism and necessity. But your observation will be duly noted, Dr. Castillo. Thank you very much.
Mr. Chair.
Oh, Congresswoman Swansing wants to be recognized.
Mr. Chair, in the interest of time, because our chairperson Helen Tan has another meeting, can I make a motion na, Mr. Chair?
Well, yes,
Mr.
I was
Chair.
waiting for that.
Mr. Chair, I move to approve unnumbered substitute bill to House Bills number 6809 by Representative Tambunting, House Bill 6821 by Representative David Suarez, House Bill 7007 by Representative Luis Raymond Villafuerte, House Bill number 7157 by Representative Alfred Vargas, House Bill number 7267 by Representative Rufus Rodriguez, House Bill number 7274 by Representative Paul Daza, House Bill number 7331 by Chairperson Helen Tan, House Bill number 7361 by Representative Divina Grace Yu, House Bill number 7365 by yours truly and Representative Horacio Swansing Jr., House Bill number 7383 by Representative Joaquin Chepeco Jr., and House Bill 7469 by Representative Manuel Cabuchan III with amendments and subject to style. So moved, Mr. Chair.
Is there a second motion?
Mr. Chairman.
Second.
Congressman Rodriguez is recognized.
Yeah. The parliamentary situation, Mr. Chairman, is that I previously had a motion to remove the criminal provisions. And we already heard also other principal authors like our chairperson of the Committee on Health, Chair Helen Tan, who agrees that we should already remove the criminal penal provisions. So the Congressman Cabuchan. So, Mr. Chairman, if that is been now the consensus that during this hearing we remove the criminal liability, then we can proceed, and we can I can second the motion if we consider that we have already removed the criminal provisions.
Mr. Chair.
Yes, we know from the chairperson.
Congresswoman Swansing is recognized.
Mr. Chair, I said with amendments. So can we put that in the amendments?
Yeah, okay.
The removal.
Is there a second
remove the
motion?
criminal provisions.
No, the particular amendments are not being taken right now. It will be taken up later on.
No.
Mr. Chairman.
So you want to have the specific amendments right now?
Yes, Mr. Chairman, just the removal because prior to the motion, I had a motion which was duly seconded that we remove the criminal provisions. And many of the principal authors have agreed to draft it. So if that is taken by the chair as a more of a consensus to remove the criminal provisions, then the motion of Congresswoman Swansing that with amendments would now include the amendment of having the criminal provisions of the bill be as considered as removed, Mr. Chairman.
Mr. Chair, Mr. Chair, this is Congresswoman Ruth. Mr. Chair, may I be clarified on what particular penal provision will be removed? Will it be the entire penal provision, Mr. Chair? Thank you, Mr. Chair.
What is the reply of our colleague, Cong Rufus Rodriguez?
Yes, any allusion to criminal liability, meaning criminal fine and criminal imprisonment, will be removed in this bill, Mr. Chairman. That is the intention of this of the movement.
Mr. Chair, because Mr. Chair, am I recognized, Mr. Chair?
Yes, you are recognized.
Thank you, Mr. Chair, because if I understood it right a while ago po, what Chair Tan mentioned was to remove the imprisonment, but the community service will be retained. Is that it, Mr. Chair? I just would like to be clarified if the community service will be retained and the imprisonment will be dropped from the substitute bill, Mr. Chair. Thank you.
Community service would in reality be a criminal punishment.
Yes.
The only difference being there will be no imprisonment.
So does it mean, Mr. Chair, that we will do away with the entire penal provision? Because what I understood a while ago, the other congressmen agreed that the community service will be retained and the particular provision which includes the imprisonment will be dropped. That's what I understood a while ago, Mr. Chair. Or that's why I'm asking if you will be removing the entire penal provision, which includes the community service as well as the imprisonment, Mr. Chair. That's my clarification that I would like to be clarified, Mr. Chair.
Well, so far as you are concerned, Congresswoman, your position is that we remove the imprisonment, but we retain the community service.
Yes, Mr. Chair, that is my manifestation. If I am allowed to say my manifestation, that's my humble opinion, Mr. Chair. If we can retain with the community service and drop the imprisonment for the as part of the penal provision, Mr. Chair. Thank you. Thank you, everyone.
What is your reply to this manifestation, Congressman Rufus Rodriguez?
Mr. Chairman, the community service is a criminal penalty. And therefore, I am averse to having criminal penalties in this. We have heard the doctor saying it's even difficult already to get volunteers for calamities and for other occurrences in the country. And if you have liabilities like this, the more you will discourage people from volunteering. And secondly, it does not really bode well. So I would say that all criminal penalties, Mr. Chairman, would be removed, Mr. Chairman.
Okay. So right now, the parliamentary situation is that Congressman Rodriguez is moving for the amendment for the removal of the entire provisions which would be criminal in nature, including community service. However, Congresswoman Robles wants the retention of community service but removing imprisonment. So how do we resolve the issue? Do we have to vote on this right now among the members? Or you just want to approve the bill and all these amendments be taken up in the floor for further discussion, considering that the issues is a little bit complicated?
Mr. Chair.
Mr. Chair. Sorry, this is Congresswoman Ruth Hernandez, Mr. Chair.
Yes.
Not
Sorry.
Robles.
Congresswoman Ruth.
It's okay, Mr. Chair. Thank you.
Hernandez.
Thank you,
From Laguna.
Mr. Chair,
the chair of our governor.
Mr. Chair, the chairperson, Helen Tan, is raising her hands. Kanina pa po.
Congresswoman, Chairperson Tan, I did not see you. You are recognized.
Yes, sir. Thank you po. If that's the position of Representative Ruth Hernandez and Representative Rufus Rodriguez is not amenable on that, if I may suggest that we just put that all volunteers or those who are enlisted who underwent or undergo trainings should pay or parang in a form of reimbursement yung ginastos ng gobyerno. I think kasi yung community service is not a criminal offense. I'm so sorry, I'm not a lawyer po. So if the body is amenable to that kind of penalty, that that certain person reimburse every expenses that the government for the for consideration of the body, so that we can finally move forward.
Mr. Chair, Mr. Chair, this is Kong Ging. Since the penalty clause is from Representative Cabuchan.
Medyo nawawala na ang mga kasama natin.
Mr. Chair, this is Kong Ging.
Yes.
Yes, Mr. Chair, can we give the floor to Representative Kabochan because that's his bill, the penalty provision. Can we give the floor to him?
Mr. Chair, but before, Mr. Chair, this is Congresswoman Ruth. Before we recognize Honorable Kabochan, I would like to withdraw my my motion a while ago for the penal provision. I submit to the will of Congresswoman Tan. I submit to her recommendation a while ago that it's okay if you will remove the whole penal provision so that there will be no criminal liability. And I submit to her suggestion or recommendation that maybe reimbursement will do. Just so po, hindi naman masayang po yung pondo o budget na nilagay ng ating pamahalaan. Yun lang naman po ang sa akin. But it's okay with me, it's fine with me if tanggalin na po the whole criminal provision kung ang community service is also part of criminal liability na ipapataw sa ating mga members of the medical corps. So that's fine with me. Yung reimbursement po, that's okay with me as long as wala naman po na masayang na pondo coming from the government. So yun lang po before po magsalita ang kagalang-galang Kabochan. Thank you po, Mr. Chair. Thank you.
Kagalang-galang Kabochan ay kinikilala ng presiding officer.
Maraming salamat po, Mr. Chair. Amenable po ako na tanggalin yung penal provision, yung provisions po, penalties, and amenable din po ako dun sa suggestion ni Madam Chair for the reimbursement of government expenses po dun sa training. Maraming salamat po, Mr. Chair.
Is there any other observation of our colleague before we finally decide on the motion of Congresswoman Swansing? There being none, is there a second the motion?
Second the motion, Mr. Chair.
Is there any objection? Is there any objection? There, hearing no objection, the motion of Congresswoman Swansing is hereby approved.
Thank you, Mr. Chairman.
Thank you, Mr. Chair. Thank you.
Chairperson Angelina.
Well, aside from saying thank you, is there any other motion?
Hindi pa tapos. May local bills pa.
Meron pa ba? Meron pa tayong bills?
Local bills.
Oh, all the local bills. Oh. Is there any observation, manifestation, or objection to all these local bills?
Mr. Chair?
Dito ba sa mga local bills? Toto, sino ba ang merong reservation, question, clarification?
Mr. Chair, naghintay yung mga authors.
So,
pasalitain naman natin sila.
Sino ang mga authors na kikilalanin ko? What about Congressman Florencio Noel?
Mr. Chair, may I suggest to call COMSEC to one by one acknowledge the local bills and as well as the authors, if I may suggest. Si COMSEC.
Huwag ka na magtanong ha.
Yes sir, for a while lang po.
May warning si Tita Lorna.
So, maybe call on number 1.
Go.
If he's not around, may we call on Representative Lorna Bautista Bandigan of House Bill number 4405 po.
Kana,
go.
Thank you, my colleagues. Manong, grabe ba? Di pa hulap ninyong dugay. Okay.
You are recognized. You are given 1 hour to sponsor your bill.
1 minute na lang, Manong. 1 minute. Okay.
Okay, 1 minute.
Madam Chair. Okay. Go. Madam Chair, my esteemed colleagues in Congress, resource speakers, good morning. Good afternoon na ito eh. I filed this House Bill number 4405, an act increasing the authorized bed capacity of the Tomas Lachica District Hospital in the municipality of Abad Santos, province of Davao Occidental, from 25 beds to 50 beds, upgrading its medical facilities and improving healthcare services and appropriating funds therefore. The rationale for this bill is because the municipality of Abad Santos is in the southernmost tip of the province of Davao Occidental. It has 100,000 inhabitants who are indigenous and indigents. Hence, for the need of an increased bed capacity from 25 to 50 to meet the medical needs. Madam Chair, I move that the committee adopt and consider the explanatory note as my sponsorship speech. Thank you very much.
Any member who wants to make any clarification or interpolation regarding House Bill number 4405?
I move to approve, Mr. Chair.
Thank you very much, everyone.
Is there a second? Is there any objection?
None.
There being no objection, and upon the motion of our colleague, House Bill number 4405, authored by Representative Lorna Bautista Batingan, is hereby approved.
Bandigan.
Bandigan.
Bandigan, sorry.
I love you, Tita Lorna. I love you.
Congratulations po.
Thank you.
Comsec is hereby directed to read the next local bill.
May we call on Representative Christine Alexi B. Tutor, author of House Bill 4723. Your Honors.
Thank you po, Mr. Chair.
Yes, you are recognized.
Mr. Chair and Madam Chair, and to the members, I would like to emphasize, aside from my explanatory note, the extreme need of having a DOH-run hospital in the 3rd District of Bohol. Aside from being the biggest district in the province, the realization of this hospital will cater to more or less 150,000 constituents, population-wise, serving 5 barangays. The present Kandihay Community Hospital has a big potential for expansion. LGU Kandihay already made their commitment to help in its development. Lastly, it's about time to put a district hospital in the 3rd District of Bohol, which for the last 45 years in existence is under the provincial government. Its development is so slow. It pains seeing this reality that only the 3rd District, the biggest district, has no DOH-run hospital, 92 kilometers and 40 kilometers respectively in opposite direction to the nearest DOH hospital. Mr. Chair, Madam Chair, I humbly ask of this respectable body for support that this request be granted to efficiently and effectively deliver the health services to the people in the 3rd District of Bohol. Thank you, Mr. Chair.
Maraming salamat din. Meron ba tayong mga kasamahan na gusto mag-interpolate o magtanong o mag-clarify sa House Bill number 4723?
Mr. Chair.
Yes. Congressman Ecleo.
Alan Ecleo po. Opo. Wala na pong maraming tanong-tanong dyan. Kailangan po ng tao ng Bohol yan. Kaya I move to approve House Bill of Congresswoman Alexi Tutor po.
Second motion.
Second.
Is there any objection? There being no objection, House Bill number 4723 is sponsored by Congresswoman Christine Alexi B. Tutor is hereby approved.
Thank you. Thank you, Mr. Chair. Maraming salamat.
Okay, maraming salamat din.
Congrats, boss.
Comsec is hereby directed to read the next bill.
For a while, Your Honors.
Comsec?
Yes, sir. May we call on Congressman Alan Ecleo for 6949, or was it already covered?
No, not yet.
Not yet po.
Ayan.
Finally.
Number 7. Number 7, sir. House Bill 6949. Thank you, sir.
Kanina pa si Alan.
Opo. Mr. Chair, may I be recognized?
Yes, you are recognized.
Thank you so much,
Kilala
Mr.
ka
Chair.
na presiding officer. You can speak right now and sponsor
Maraming
your
salamat
bill.
po. Honorable Chair, esteemed colleagues, thank you for giving us the opportunity to speak on the merits of the House Bill 6949. which will establish in the municipality of Basilisa the very first level 2 health facility in Dinagat Islands po. As we have discussed in our explanatory note, currently all other health facilities in the island are on an infirmary level status only. This means that at present, all trauma patients and other critically ill patients need to be transported by sea to Caraga Regional Hospital in mainland Surigao City, while patients urgently in need of specialized surgery must be sent to Southern Philippines Medical Center in Davao City, which is not less than 8 hours of travel by land from Surigao City. Even before pandemic, this has posed significant threats to the survival of pregnant mothers, victims of accidents, and other patients in our province. Bad weather conditions could cause sea travels to be canceled. And many times, since sea transport is not available 24 hours, patients' families would have to be burdened by securing a sea craft willing to travel during the wee hours of the night. With the difference of life and death being at times only a matter of seconds, a 1.5 to 4 hours long travel by sea or an 8-hour long travel by land should not be an option. And thanks to the soon-to-be established Level 2 hospital, it will no longer be an option for my fellow Dinagatnons. We hope that our colleagues and our resource speakers, especially from the DOH, share our enthusiasm in making sure that this bill will pass at the soonest possible time for the benefit of our constituents in the province of Dinagat Islands. And we trust that we are one with us in realizing the promise of this very urgent initiative. Thank you, Honorable Chair, and I look forward to hearing from our Honorable Committee and our panel of resource speakers. Maraming salamat po.
Our colleagues, meron bang gusto magtanong kay Congressman Alan Ecleo?
Mr. Chairman.
House Bill number
Mr.
6959.
Mr. Chairman. Mr. Chairman.
Yes.
Mr. Chairman.
Yes, you are recognized.
To return the favor po, para mas madalian po, I move for the approval of House Bill number 6949 of Congressman Alan Ecleo. So move, Mr. Chair.
Second, Mr. Chairman, second.
Is there an objection?
Maraming salamat po.
Kung Ecleo, kumusta?
There being no objection, the motion to approve House Bill number 6949 is hereby approved.
Congratulations, Kong Alan. Congratulations.
Thank you. Maraming salamat po, Kong Ropus.
Kong Alexis, kumusta?
For Dinagat, yes.
Next local bill.
Miura. Ay.
Yes, sir. May we call on Congresswoman Shari Antan for House Bill 7448. And may we also ask Congress Vice Chair Tutor to sponsor other House bills, ma'am, whose authors were not around. May we ask Vice Chair Tutor?
Yes, Mr. Chair. Mr.
Yes, you are recognized.
For House Bill number
Before Mr. Chair, before Congressman Tutor would move for all bills, I can see the message of Congressman Fidel Nograles that he is already on cam. So on Zoom, can we hear him first, Mr. Chairman?
No, we just hear first what was read by the ComSec to have some regularity. Then we go to him later on.
No, because Mr. Chairman, because this will be
Mr. Chairman, I would like to yield to Representative Nograles, being him already in the Zoom meeting. So I would like him to have his floor first before I will take an omnibus motion for all the rest House bills that are present here for expedition of our discussion. Thank
Nograles is recognized. Congressman
Mr. Chairman, good morning. Mr. Chairman, good morning.
Yeah. Yes. It's already 12 o'clock. Continue.
I'm here for House Bill 6524. I move for the adoption of explanatory note of House Bill SUK 6524, establishing Northern Tagalog Regional Hospital. As my sponsorship speech for House Bill 6524, so moved, Mr. Chairman.
Just a clarification from the chair. The title of the bill is an act establishing the Northern Tagalog Regional Hospital. And insofar as your bill is concerned, what would be the coverage of operations of the medical facility? Only in municipality of Rodriguez?
No, Mr. Chairman.
Yes.
Also cover different parts of Metro Manila with a catchment area of around 500,000 patients.
So specifically, what would be the territorial jurisdiction of the hospital so that we can be clarified?
The hospital will be situated in Montalban, but the surrounding catchment areas include informal settlers as well as socialized housing communities around San Jose del Monte, Bulacan, and in Quezon City, in NCR, and in San Mateo, Rizal, and in Montalban, Rizal.
As a lawyer, do you not think that this is a local bill and therefore the territorial jurisdiction being covered by the medical facility should be authors of your bill? I'm just observing what it should be. Unless you want to agree on this.
Mr. Chairman,
aabot ng San Jose del Monte. Ano pang bayan ang aabutin nitong Northern Tagalog?
Yes, Mr. Chairman, I requested for co-authorship from the affected representatives from San Jose del Monte and from Quezon City.
Oh, nag-co-author ba sila? Kasi
I've already submitted a request for co-authorship.
No, they should be principal authors because this is a local bill affecting their territorial jurisdiction.
No, sir.
And perhaps we can hear the comment of Congressman Rufus Rodriguez, our authority in law. Congressman Rodriguez is
Thank you. That's questionable, but anyway, Mr. Chairman, I would like to just state that it's enough that we have an author for this bill. Hospitals, although it may have a headquarters where it will be built, is always open for everyone. Like PGH, for example, is in Manila, but it's open for everyone. So although there are no co-authors, this is still a valid bill to be approved, Mr. Chairman. So I move that we approve the bill of Congressman Fidel Nograles. Thank you, Mr. Chairman.
Okay, the chairman will just be making some reservations insofar as interpolation in the plenary is concerned.
Yes,
okay?
Thank you, Mr. Chairman. Thank you. So move, Mr. Chairman.
To the motion?
I second the motion, Mr. Chair.
There being none, House Bill number 6524 is sponsored by Congressman Juan Fidel Felipe Nograles is hereby approved with the reservation for interpolation by the acting chairman.
Congratulations. Congratulations, Fidel.
Comsec.
Thank you, sir.
Yes, sir.
Please continue. I understand that Congresswoman Tutor will be making an omnibus motion.
Yes, Mr. Chair.
There will be no objection on the part of the sponsors of the local bills.
Mr. Chair.
Yes.
Kong Kaloy, Zarate.
Yes, Kong Kaloy, my good friend. You are hereby recognized.
Thank you, Mr. Chair. Before the omnibus motion of the Honorable Tutor, earlier, the Honorable Albano sponsored his local bill, no? And he manifested that he wants an amendment to his bill by increasing the bed capacity from 300 to 500 due to the circumstances that prevail now, no? Like the pandemic and the others, no? So I hope that that will be reflected as well when we approve by omnibus motion the other local bills. That would be all, Mr. Chair.
The COMSEC is hereby directed to take the manifestation, to duly note the manifestation of Congressman Zarate insofar as the bill of Congressman Albano is concerned, from 300 to 500 beds. Okay? Congresswoman Tutor is hereby recognized.
Yes, Mr. Chair, because it's already lunchtime. I move for an omnibus motion for the approval of House Bills number 3302 by Rep. Florencio G. Noel, House Bill number 5080 by Representative John Marvin Nieto, House Bill number 7123 of Representative Francis Gerald Abaya, House Bill number 7448 by Representative Shari Antan, Yeda Romualdez, and Ferdinand Martin Romualdez. And lastly, for House Bill number 7471 of Representative Abraham Tolentino for approval subject to amendments and style. So moved, Mr. Chair.
Unanimously seconded.
Second the motion.
Second the motion.
Unanimously.
Second. There will be a motion to approve all the bills, all the local bills mentioned by Congresswoman Tutor, and considering that there is no objection, all these local bills mentioned are hereby approved.
Congratulations to all.
Mr. Chair, if I may we ask the position papers of the different agencies, national agencies that are present here today to submit to the committee their position papers for consideration. Thank you, Mr. Chair.
Okay. The manifestation is duly noted regarding the position papers. Is there any other matter to be discussed by this committee right now? COMSEC?
Wala na po, Your Honors.
Oh, if there is none, what would be the next motion?
Move to adjourn.
Chair.
Move to adjourn.
Is there any objection?
Lunchtime.
Thank you, everyone.
Thank you, Mr. Chair.
Thank you, Alexis. Thank you, Alan.
Thank you.
Thank you. Maraming salamat.
Pasensya na, Vice Chairman Gato.
John, happy birthday ulit.
Sorry, nawala ako kanina yung signal. Nasisira dito.